Hi, this is Jen Maleka and Reed Davis with Functional Diagnostic Nutrition, and we wanted to jump in and chat with you specifically about everything that's going on right now in the current state of the world and the current climate with the coronavirus, known as COVID-19, and what we feel like that means for the health professionals and health coaches that are out there in the industry. Because honestly, you guys, I'm really excited about this. I think this is a perfect opportunity for all of us to rise up and to enact the change that we've been wanting and waiting for in the world. And the time is now. So Reed, I know this is something that you and I have been talking about, like how we've been talking for years, about how we need more health coaches in the world in order to enact change in the healthcare system and in people's lives. And we're seeing that now more than ever. So share your insights with us about this, because I know, you have a great saying that you've been using, like Thomas Edison was wrong, and explain that to us, because what we're seeing now directly relates to that. And you're so right in so many ways.
Yeah, Thomas Edison was wrong, but now his prophecy is actually going to come true. And what he said was that the doctor of the future will give no medicine, but will interest his patient in diet, care of the human frame, and the cause and prevention of this disease. Well, when he said the doctor of the future will give no medicine, he was just wrong. Last year, 4.2 billion prescriptions were filled. So he's wrong about that part. The good news is that the interest in diet, care of the human frame, and the cause and prevention of disease, that need is being filled by health coaches. And we are perfectly positioned to do that. That's what we do. We educate people. We interest them in those things. Doctors do what they do. They're very, very important. In healthcare, they can intervene when your health's going south real fast, and they're always good to have around for symptom removal, managing diseases, things like that. But that doesn't make you healthy. What makes you healthy is following a healthy lifestyle. It's understanding what diet's right for you, what sleep patterns are required and how important it is. What kind of exercise should you be doing and how much? Stress reduction is really huge. And so, of course, our supplements. So these are the things that we are experts in, at least the way I teach it. And not to mention all the positive psychology and habit forming and things like that. So again, we're perfectly poised. I'm not one to take advantage of any disaster or, like taking a crisis and trying to make money off it. I'm just trying to say that if you thought the world was unhealthy before, we know about environmental contaminants and pollutants and all the things that are making us unhealthy. Unfortunately, my son or grandsons are not going to live as long as I do, because the world is just such a more rotten place, in terms of the things that can get you, But now with things like these pandemics, which this is not going to be the last one. This is the beginning of a bunch of them that are probably coming down the pike. And what is the most common thing you hear on TV, if you watch it, or the radio or whatever, about who's affected by coronavirus and other serious things? It's people who are already unhealthy.
Yeah.
Some of them are older. Most of them are older. But it's because they were unhealthy that they're the easy target for some of these pathogens. Now, don't take the pathogen lightly. It's pretty serious. I was around when AIDS came out. It was Ebola virus and SARS and MERS and these other things. They don't seem to be as bad as this. In other words, this one is, and one of the reasons is because it's spiking so fast. I mean, you've seen the lines and you've seen what's going to happen at hospitals. I just heard today they're bringing military hospital ships into port in New York and somewhere on the West Coast as well. So it's only going to get worse. Here we are at the middle of March. By middle of April, you could really see like 10 times the people or 100 times the people. I don't know exactly. I just know it's not going to. And the ones who are already well have the best wall around them. So what health coaches can do is help people reinforce that wall around them in terms of being resistant to some of these bad bugs that are coming down the pike. And again, I think coronavirus, This is just one version, and there's others going to come around.
Yeah.
And especially if people keep doing the things that they're doing to where we get these weird viruses coming out, you know, and I could talk a little bit about that, but I think it's quite remarkable.
Yeah, and that was the point that I was going to actually bring us to, Reed, is, you know, first of all, that statistic that you said about prescription medications is alarming, right? And I think that that is a clue to what we're actually seeing right now with the pandemic. And in, you know, the FDN course, what we talk about in our methodology is that symptoms are the last thing to show up in a dysfunctional state, right? So I kind of see the coronavirus like this is a symptom of something greater that's been going on for a really long time. You know, like you said, the people that are most susceptible to it are the people that already have underlying conditions or illnesses. They're saying immunocompromised. Well, the definition of immunocompromised is just a weakened immune system. And as we know, in the work that we do as FDNs, you know, things that can weaken the immune system can be really simple sometimes, like eating inflammatory foods or food sensitivities or the toxins in our environment, mental, emotional stress, malnutrition, like poor nutrient absorption, that those, you know, congested liver. So if we think about that list of things, you know, we could even say that all of us have a degree of a weakened immune system potentially. So this is where health coaches can really step in. And this is proving to us that there is a greater problem that we need to shift here. And as you mentioned already, health coaches are perfectly positioned to be the ones that are going to enact change, that are actually going to help people with diet and lifestyle factors. It's going to boost their immunity, that's going to resolve underlying conditions, that's going to, you know, touch on the healing opportunities that the individual person has in order to truly have health, like to build health, to have health. And I think right now, you know, people are really hyper aware about their health. So tell us a little bit more about how symptoms are the last thing to show up in, you know, a dysfunctional state already, like, and how things can be far removed from the cause and how that may reflect on the coronavirus situation that we're experiencing right now.
Well, people to some degree are less resistant than others, let's say. So there are weak links in metabolism that could be inborn or they could be acquired over time. So unhealthy people tend to get more and more unhealthy and more things occur. Part of the problem is that they never really look for the underlying causes, and they don't try to prevent, like what Edison predicted. And for one thing, you know, one reason for that is that the medical system isn't geared towards teaching that way. They wait till you're sick and treat you. People go to physicians all the time and they're told, oh, your blood work looks normal, there's nothing wrong with you. Meanwhile, they feel like crap, you know, and they might have something about the way they look too that they don't like. So they look and feel less than, and there is something wrong. It just doesn't show up in standard medicine because of the parameters that they use. Mm-hmm. So health coaches can look at subclinical markers. They can run labs that are just functional. We don't look at them so much to identify treatment options. We don't want to treat the paper anyway, but more healing opportunities. So when you talk about these things that are way upstream from where the symptoms appear, it's really true. People with the exact same set of symptoms, exactly identical word for word, could have them for completely different reasons. You know, different input into unique systems with their own weak links could, you know, rumble down and create that same set of symptoms. Now, this is the other funny thing. People with the exact same causes, because of weak links in metabolism and biochemical individuality, can end up with, they have the exact same causal factors, let's say the environment and whatever you want to name off, but they have completely different sets of symptoms or clusters of symptoms. So this is why we don't, as health coaches, diagnose and treat anything specifically. We work upstream to what are the contributors to that metabolic chaos, we like to call it, so that we're not doing specific treatment. We actually work on everything non-specifically. And so when you use a corrective diet, corrective sleep, corrective exercise, corrective, especially around stress reduction, there are so many variables when it comes to stress and how it affects you, none of them good. I mean, there is such a thing as good stress. We're talking about distress,
right,
whether it be mental, emotional, physical trauma, bodily, things, musculoskeletal things, aches and pains and that. And then, of course, the chemical and biochemical stressors.
mm-hmm.
So this is an area where we can be the most helpful. And supplements are important. The advancements in nutraceuticals and these kind of things are outstanding. Not to mention that there's herbalism and things that have been around for millennia that are just known, time-honored ways to help your body out, help restore function, things like that. So this idea of DRESS, diet, rest, exercise, stress reduction supplement, it's a remarkable book of knowledge, if you will, and methodology, if you will, to just have an effect on every cell, tissue, organ, and system. Now you end up with a very resistant person who's got a lot of vitality, a lot left in the tank. These are the people who are going to live older and not just have more years in their life, but more life in their years.
Right.
And again, there's kind of ways to test for all that we enjoy having that opportunity to look at data and use it to guide our programs.
Exactly. And that's where I think that the health coaches right now, and particularly people that are trained in the kind of work that we do, are perfectly positioned, because this situation, as I mentioned earlier, is creating a hyper awareness around health, right? People are questioning their health. How strong am I to be resistant to this type of virus? What is going on with my immune system? These nagging health conditions or things that have been going on in my health, like I've been ignoring them. So oftentimes it takes a catastrophic event for somebody to prioritize their health, like maybe a near-death experience or like a chronic condition diagnosis. But what we're actually seeing now is a worldwide catastrophic event that is causing everybody to think about their health on a different level. And I feel, Reed, that we're going to continue to see this as we get out of the storm of coronavirus. Like right now, there's like the urgency to self-quarantine and for people to practice physical distancing to, flatten the curve, as we've been calling it. But everybody's going, it's forcing people to look inwardly on what's going on with them, to rethink their priorities. And they're going to be coming out of this situation going, how can I, the survivalists specifically out there are going to be like, how can I protect myself for future? Because as I think most of us are starting to learn, like you said, like this isn't the first pandemic that we're going to have. There's more that are probably going to come. And so there's going to be a huge, group of people out there in need, or people who are going to be looking for these personalized approaches. Like, I really want to get to the core of my health. And that's something that, as health coaches, we can help them do. And as FDN practitioners, we can help them even on a deeper level, utilizing some of the lab testing in order to uncover those hidden healing opportunities and create long-lasting, sustainable results, because we're actually resolving underlying issues, like you said, positively impacting every cell, tissue, bone, and organ, basically in the body, to build health and vitality naturally that somebody will have for a lifetime, right? And so
that's the goal.
That is the goal. So for all of our, people out there that are part of our community, if you are already an FDN or a health coach, know that people need you. If you're somebody who has been thinking about getting into the health coaching industry or becoming a health professional, now is the time, because as we get out of the storm, we are predicting that we're going to need more health coaches than ever before to help people on this personal and individualized level, and not just with diet and exercise, but actually uncovering their own hidden healing opportunities, utilizing the lab testing in order to do that. And let's also just address another piece of change that coronavirus is inflicting upon us, and that is moving into an even more virtual online world. We thought that we were virtual and we were online, and yet you're seeing a lot of these companies and organizations that are struggling because they don't have online capabilities set up. Well, one of the unique things about the work that we do is that we are global. So we have FDN practitioners and health coaches all around the world. We have lab partnerships around the world. I have clients around the world. I'm in San Diego. I have clients in Australia and Canada and the UK, and I have a 100% virtual practice, as most of our FDN practitioners do. And people are going to be looking for those online solutions, especially as we move forward into, we have no idea how long this kind of self-quarantine is going to go on for right now, potentially. And if it happens again in the future, the people who already have an online business are perfectly set up. Like, I know it hasn't really personally impacted me because I was already seeing my clients virtually. And so I didn't have to close my doors to my brick and mortar store. And I can still help my clients out and all those things. So, Reed, I'm actually really excited about this for all of the healers and the health coaches that are out there, because, not to capitalize on a dire situation. However, let's look at the opportunity that is here and how we can serve people and help them on a greater scale, and how we're being called up to step up as leaders and to do this work and to help enact the change that we all have been wanting to see in the healthcare industry.
Yeah, amen to that. As I listen to all the things we're being told to do, a lot of them we're already doing, and we've been doing it. That's been our lifestyle, to stay really healthy. Take your vitamins and minerals and essential fatty acids and, phytonutrients and all these things to help boost your immune system and all that. One of the prerequisites to be a health coach is walking the talk. That's what we've said. Look, you can join us if you're willing to learn, if you're willing to walk the talk, and if you like helping people. Mm-hmm. And so that's basically it. And guess what? The need, as Jen just laid out, is just going to grow. I mean, already before this thing, I've talked to people who want to invest in what we do because they know that health coaching is one of the fastest growing industries, if you want to call it that. And it's got an amazing place. Imagine if every doctor had 3 or 4 health coaches working for them. You'd need, hundreds of thousands of health coaches. Dr. Russell Jaffe, who's a buddy of ours, a really brilliant research guy, owns a lab and a supplement company. So he goes around the country talking to groups of doctors. They get their CEUs, their relicensing credit, just by going and listening to this guy. And he said that this country needed, this is before this kind of crisis stuff, almost 300,000 was his estimate. So that's a lot of health coaches, and it's probably going to double or triple. I'd like to talk to him today and see what he thinks. So there's jobs, but more importantly, probably the opportunity to be an independent. At least that's the model that I teach. Mm-hmm. So we're already taking good care of ourselves, already doing those things. We already, don't put our fingers in our mouth and, fist pump. We do that, we already work from home. With the virtual practice. 20 years ago, I started doing that as a result of, I was going out in the public lecturing, and I just started getting farther and farther away from the office. And finally I decided that, there's no reason for you to drive all the way to the office. We'll save you an office visit fee. I'll just work with you over the phone. Mm-hmm. That was back in the days where you had pagers, and a ring-a-ding phone. Right. You had to be, but so we've been distance coaching for close to 20 years, and it works. It works great. It's convenient on the client, and it's convenient for us, and we get to live the lifestyles we like. Again, walking the talk, there's hardly much more important than that.
Exactly. And we even have physicians and healthcare providers that reach out to us to ask us to hire our FDN practitioners. So if that's more your fix, like, those opportunities are definitely there too. But I think as a lot of people are learning, is having a virtual capabilities as a backup right now, in this modern day world that we live in, is essential. And so we help to prepare you for that as well. So Reed, is there anything else that, we want to wrap up with here and tell our listeners, any other important messages as we kind of move forward together through the storm and help to empower people as we do that?
Well, I think be grateful for the health that you have. Be positive. Don't let creepy negative stuff seep in too much. I mean, it's really hard sometimes, but you have support from any. There's not. I've trained thousands of people. There's not one of them that wouldn't give you some support and help. And then join a community like ours so that you can just carry that forward. So I would say be grateful for what you have, and don't be alone. Even though we're told to sequester ourselves and all that, don't be shy about reaching out and asking for help. And if it's help in your business, like you're struggling, you hate your job or whatever, and you want to be a health coach, we certainly have a pathway for you for that.
Yep. And I am really impressed with how our community of students and graduates has banded together to support each other in this time. That's something else that I find hugely valuable about being an FDN myself. And just to elaborate more on what Reed has said is that we are here to support everybody that is connected with us in any kind of way. So if you guys are looking for insights and inspirations, please feel free to message us, comment to us. We're here to support you and, recognize the opportunity that is available to you. And if you've been thinking about the FDN course and, we're all being kind of sequestered to be at home, you have some extra time to study, please reach out to us to explore opportunities to do that. I mean, we want to be as sensitive to everybody's, personal state right now and what is best for you. We have, support that is available to you. Our course counselors are here to help you out to kind of figure out, how do I do this? How do I get into the certification course? How do I create a business out of this? How do I make this transition or elevate myself through this process? And we are extending our resources to all of you out there to help you out with that. Like Reed and I even both personally opened up our calendars to the students in our community to schedule to get extra support with us around their businesses and what it is that they need, because we care about every single one of you that is out there. So please, as I said, message us, comment to us, let us know what it is that you need, how we can help you. And if you're ready to help people on a deeper level and be at the forefront of this change that we are seeing, please reach out to us with questions and get into the FDN course today, because there's no better time than now, you guys. So thank you so much, Reed, for your positive thoughts on this. We will possibly be hopping on more frequently over the coming weeks to give you guys more inspiration and empowerment. And as we said, reach out to us if you need anything. All right, you guys, signing off.